Hello and welcome to this presentation on research designs in health research. My name is Dr. Itaki, and in the next 30 minutes, we will explore how various research designs are used in health and medical studies. We'll cover both primary and secondary research, and we'll describe the main types of epidemiological study designs and take a closer look at cross-sectional studies as a key example. Firstly, let's have an overview of the study designs. Health research broadly falls into two categories: primary research and secondary research. Primary research involves generating new data through direct experimentation or observation. This includes basic science research, clinical trials, and epidemiological studies. Secondary research refers to the summarization and analysis of existing studies, for example, systematic reviews and meta-analysis. So how do we decide and choose a study design? It starts with a clear and specific research question. The study design you choose must align with the question you are trying to answer. Let's now look at the hierarchy of medical evidence. In evidence-based medicine, different study designs offer different levels of evidence. At the top of the hierarchy are systematic reviews and randomized controlled trials, sometimes known as RCTs. These offer the most robust evidence. Mid-level studies include cohort studies and case control studies, while case reports and expert opinions are at the bottom of the hierarchy of evidence. This hierarchy is not about one being better than the other, but about the strength of the evidence each design can provide. Next, let's look at how epidemiological studies are classified. Let's now look at these different study designs, which are widely used in public health and in clinical research. This can be grouped into two main categories. Number one, experimental or interventional studies, for example, randomized controlled trials and community intervention trials. Number two, non-experimental, or sometimes referred to as observational studies. These include descriptive studies like case reports, case series, and cross-sectional studies. Analytical studies like cohort studies and case control studies are also sometimes known as non-experimental or observational studies. In experimental designs, the researcher controls the exposure or intervention. In observational designs, the researcher merely observes and then reports the data and analyzes the data. Let's now look at cross-sectional studies in detail. Cross-sectional studies are used to determine the prevalence of a health outcome. They explore determinants of a condition, or these study designs are used to describe population characteristics. Looking at the design, these studies are like a snapshot, so they measure the exposure and outcome at the same time and are reported simultaneously. For example, in cross-sectional study designs, the participants are recruited based on specific inclusion and exclusion criteria, and the exposure and outcome are measured at the same time, and the prevalence of the variable is reported. Let's now look at some advantages and limitations of cross-sectional study design. Firstly, cross-sectional studies are fast and effective. They are useful as baseline study designs for collecting data, and they are ideal for public health planning. One of the key limitations of cross-sectional study design is that you cannot establish causality, and you may need to do other study designs to find out the cause of a phenomenon. Number 2, cross-sectional study F selection bias. And number 3, you can only report a point prevalence if you're doing a cross-sectional study. And finally, cross-sectional study cannot allow you to generalize to a wider population. Let's look at data analysis in cross-sectional studies. Analysis typically involves prevalence estimates. Sometimes you can do odds ratio, or you can also do logistic regression. This really depends on your research question, participant selection system, and the data collection system that you use. Since bias can be a major limitation factor for cross-sectional studies, let's look at some sources of bias. And when we are trying to understand bias, there are major types of bias that we can classify them into. And the major types of bias are, number 1, selection bias. And this can be solved by random sampling or having a system of randomization to select the samples. And number 2 is information bias. And this can be solved by using validated tools. And number 3 is that, like all other study designs, cross-sectional studies can have confounding factors which may need to be adjusted for and considered when reporting the results. This slide shows some examples of cross-sectional studies that have been done within the Pacific and published. Some a simple hospital-based surveys, whereas other studies, for example, the PNG Demographic and Health Survey, is a nationwide survey that was done. To assess the quality of published studies, you can use many checklists or many quality checklists that are online, and one of the common ones that's used is known as the CASP checklist. You can Google this checklist and use it to assess quality of cross-sectional studies that are published in journals. Thank you for watching. Please do like and subscribe and leave a comment if you found this lecture useful.